Today, we're going to talk about the Humalog Junior Kwikpen Insulin Pen, half unit. This medication is used to control high blood sugar in people with diabetes. It helps prevent kidney damage, blindness, nerve problems, loss of limbs, and sexual function problems. Proper control of diabetes may also lessen your risk of a heart attack or stroke. The Humalog Junior Kwikpen Insulin Pen, half unit is a man-made product that is similar to human insulin. It replaces the insulin that your body would normally make. It starts working faster and lasts for a shorter time than regular insulin. It works by helping blood sugar, glucose, get into cells so your body can use it for energy. This medication is usually used with a medium or long-acting insulin product. It can also be used with other oral diabetes medications, such as sulfonylureas like glyburide or glipizide. The dosage of Humalog Junior Kwikpen Insulin Pen, half unit should be determined by your doctor based on your individual needs. It is important to follow your doctor's instructions carefully. The best time to take this medication will also be determined by your healthcare provider. Be sure to discuss any concerns or questions with your doctor. Before using the Humalog Junior Kwikpen Insulin Pen, half unit, it's important to read the patient information leaflet and ask your doctor or pharmacist if you have any questions. Make sure to learn all the preparation and usage instructions from your healthcare professional and the product package. Before using the insulin, check it visually for particles or discoloration. If you see either of these, do not use the insulin. Insulin Lispro should be clear and colorless. Clean the injection site with rubbing alcohol before injecting each dose. Change where you inject each time to reduce the risk of skin problems. You can inject the insulin into the stomach, thigh, buttocks, or back of the upper arm. Do not inject into red, swollen, itchy, or damaged skin, and do not inject cold insulin. Keep the insulin at room temperature. Your doctor will direct you on when to inject the insulin, usually within 15 minutes before or immediately after a meal. Do not inject into a vein or muscle, as this may cause very low blood sugar. If you are using an infusion pump, follow the instructions provided and avoid exposing the pump to direct sunlight or heat sources. The dosage of the insulin will be based on your medical condition and response to treatment. It's important to measure each dose carefully, as even small changes in the amount of insulin can have a large effect on your blood sugar. Check your blood sugar regularly as directed by your doctor and use this medication at the same times each day. And remember to inform your doctor if your condition does not improve or worsens. Some side effects of using the Humalog Junior Kwikpen Insulin Pen, half unit may include injection site reactions such as pain, redness, or irritation, as well as weight gain. If these effects persist or worsen, it's important to inform your doctor or pharmacist promptly. Remember, this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential risks of side effects. However, it's important to be aware of any serious side effects that may occur, such as signs of low potassium levels in the blood, and to notify your doctor immediately if you experience any of these symptoms. It's also important to be aware that this medication can cause low blood sugar, which may result from not consuming enough calories from food or doing unusually heavy exercise. Symptoms of low blood sugar include sweating, shaking, fast heartbeat, hunger, blurred vision, dizziness, or tingling in the hands or feet. It's recommended to carry glucose tablets or gel to treat low blood sugar, and if not available, to consume a quick source of sugar or drink fruit juice or non-diet soda. Be sure to inform your doctor about any reactions and the use of this product, and to follow their guidance on how to manage missed meals to prevent low blood sugar. Additionally, symptoms of high blood sugar may include increased thirst and urination, and if these occur, it's important to inform your doctor right away. It's also important to be aware of the potential for a serious allergic reaction, and to seek medical help immediately if you notice any symptoms such as rash, swelling, severe dizziness, or trouble breathing. This is not an exhaustive list of possible side effects, so if you notice any other effects, be sure to contact your doctor or pharmacist. If you are in the US, you can report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before starting to use Humalog Junior Kwikpen Insulin Pen, half unit, it's important to let your doctor or pharmacist know if you have any allergies, especially to insulin Lispro or other insulins. This medication may contain inactive ingredients that could cause allergic reactions. It's also important to discuss your medical history, including any kidney or liver disease, or thyroid problems, with your doctor or pharmacist before using this medication. Be aware that using this medication when you have low blood sugar is not recommended. You may experience blurred vision, dizziness, or drowsiness due to extremely low or high blood sugar, so it's important to avoid activities that require alertness or clear vision until you are sure you can do them safely. Limiting alcohol while using this medication is important, as it can increase your risk of developing low blood sugar. Additionally, it may be harder to control your blood sugar when your body is stressed, so it's important to consult your doctor if you experience fever, infection, injury, or need surgery. Before undergoing surgery, be sure to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. Be sure to check your blood sugar before and after exercise, as you may need a snack beforehand. If you're traveling across time zones, consult your doctor about how to adjust your insulin schedule and be sure to take extra insulin and supplies with you. Older adults and children may be more sensitive to the side effects of this drug, especially low blood sugar, so it's important to monitor closely. If you are pregnant, it's important to tell your doctor right away, as pregnancy may cause or worsen diabetes. Your doctor may need to change your diabetes treatment plan, including diet and medications, during your pregnancy. This medication passes into breast milk, but is unlikely to harm a nursing infant. It's important to consult your doctor before breastfeeding, as your insulin needs may change while doing so. When taking Humalog Junior Kwikpen Insulin Pen, half unit, it's important to be aware of potential drug interactions. Certain medications, such as beta blockers and glaucoma eye drops, may impact how your body responds to changes in blood sugar levels. This means that the usual signs of low blood sugar, like a fast or pounding heartbeat, may be masked, while other symptoms like dizziness, hunger, or sweating remain unaffected. It's crucial to keep a list of all medications, including herbal products, and share it with your doctor and pharmacist to ensure your safety. Additionally, it's essential to monitor your blood sugar levels regularly and report any changes or symptoms to your doctor. Many drugs can affect blood sugar levels, making it difficult to control. Before making any changes to your medication, it's important to consult with your healthcare provider. It's also important to note that insulin Lispro should not be used in conjunction with insulin Lispro ABC. Following these guidelines will help ensure the effectiveness and safety of your diabetes management. If someone has taken too much Humalog Junior Kwikpen Insulin Pen and is experiencing serious symptoms like passing out or difficulty breathing, it's important to seek medical help immediately. In the U.S., you can call the local poison control center at 1-800-222-1222, while in Canada, you can reach out to a provincial poison control center. Symptoms of overdose may include signs of low blood sugar, like sweating, shakiness, loss of consciousness, and a fast heartbeat. It's crucial to get help right away if you suspect an overdose. Remember to always use this medication as directed and never take more than the prescribed dose. If you have any concerns about your dosage or timing, be sure to consult with your healthcare provider. It's important not to share this medication, needles, or syringes with others. If you're using Humalog Junior Kwikpen Insulin Pen, half unit, consider attending a diabetes education program to learn more about how to manage your diabetes with medications, diet, exercise, and regular medical exams. It's also important to learn the symptoms of high and low blood sugar and how to treat low blood sugar. Be sure to check your blood sugar regularly as directed and share the results with your doctor. While taking this medication, you may need to undergo lab and/or medical tests to monitor your liver and kidney function, fasting blood glucose, hemoglobin A1c, and complete blood counts. Make sure to keep all medical and lab appointments. It's recommended to keep extra supplies of insulin, syringes, and needles on hand for your convenience and peace of mind. Remember to always follow your insulin regimen as prescribed by your doctor. If you happen to miss a dose of insulin, be sure to consult with your doctor beforehand on what steps to take. When it comes to storing your Humalog Junior Kwikpen Insulin Pen, half unit, there are a few important things to keep in mind. If it's unopened, you should store it in the refrigerator. However, once it's been opened, it can be stored in the refrigerator or at room temperature. But if you're using the pre-filled pen, it should only be stored at room temperature and never refrigerated. It's important to remember to throw away any insulin that's been in use for 28 days, even if there's still some left. And always check the expiration date on the package and dispose of any expired insulin. It's also crucial that you don't freeze the insulin or use it if it's been frozen. If you're using this insulin in a pump, make sure not to store it in the pump for more than 7 days, as it could lead to ineffective treatment and high blood sugar. And never expose the insulin in your pump to direct sunlight or temperatures above 98.6 degrees Fahrenheit 37 degrees Celsius. Always protect your insulin from light and heat, and never store it in the bathroom. And as with all medications, keep it out of reach of children and pets. When it comes time to dispose of your insulin, be sure to do so properly by consulting your pharmacist or local waste disposal company. Never flush it down the toilet or pour it into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.